Chair now wants to welcome Congressman Ruiz to the committee and recognize him for 5 minutes.
Thank you. I appreciate that, Mr. Chairman. The Clean Air and Clean Water Act protect our basic necessities, clean, breathable air and safe, drinkable water, fundamental elements we all need to survive. And we need to prioritize protecting our health. I'm an emergency medicine physician. I take care of asthma in the worst moments. I've taken care of kids who have come in with an asthma exacerbation and gone into cardiac arrest and have passed away. And those moments of me having to tell their parents that their child just died still haunt me to this day. Asthma is exacerbated by air pollution. It is one of the most common pre-existing diseases among children in the U.S. and leading cause of hospitalizations and school absences. There are over 34 million asthmatics in the U.S., including 7 million children. Annually, nationwide, there are over 10.5 million physician visits due to asthma, 2 million emergency room visits due to asthma, and $11 billion spent on asthmatic treatments. While asthma can be debilitating or even life-threatening, it can be a controllable disease. Asthma intensifies by environmental conditions such as outdoor air pollution. So why would we want to make it harder for asthmatic children in vulnerable populations to breathe clean air? We also know many of the water systems that serve low-income communities have drinking water contamination levels above federal guidelines, which can lead to a number of developmental and behavioral health issues. In my district, we have rural communities that rely on well water because there's no water infrastructure and there's high level of contaminated arsenic. Funding improvements to water systems would improve the lives of these families and children, and many of these families live in underserved areas and rely on health care, Medicaid, to get access to take care of their asthma and all of the other developmental problems that they have. Ms. Mays, tell me, are you in Medicaid?
Yes, we are covered by the Flint Water Medicaid expansion.
So that was part of the expansion?
Yes.
Okay, lead can have acute toxicity. It can cause irritability, behavioral changes, headache, abdominal pain, nausea, vomiting, all these things. That's just if somebody takes a big swig of lead toxicity. That's not what's happening in Flint. That's more of a higher dose, but doesn't cause acute symptoms. It's more chronic in nature. Those are the silent killers, the silent things where, people may have developmental delays, they have hearing problems, nervous systems, injuries, kidney, speech, language, even growth, muscle, bone development, and eventually seizures, which can be life-threatening. So if you didn't have Medicaid, what would happen to your children?
We would not be able to take them to the rheumatologist, to the osteospecialist they have to see because of their growth plates and growth problems. They would not be able to get the blood work done to consistently see what's going on. I deal with seizures at this point, so I wouldn't be able to see my neurologist, my gastroenterologist, my rheumatologist, our infectious diseases doctor, our toxicologist, and environmental physician. We wouldn't be able to see any of them because we couldn't afford it. We just do not have that money. So if we did not have the health coverage, we wouldn't be able to try to manage the side effects of these permanent damages.
And are your neighbors in the same place, the other parents of children that have these calamities?
Absolutely. Flint is 41% at or below the poverty line, so we're a struggling city as it is, and access to quality medical care, if you do not have Medicaid, is slim to none. So we have so many people that never got tested, so they don't even know how high their blood lead levels were during that first crucial 28 days. So we have people that are dying from seizures. There was a 29-year-old school security guard who had a seizure and died at the school. Wow. And we have no idea what it was caused by because he didn't have insurance. So we are absolutely terrified right now.
Any kids that you know of with renal failure on hemodialysis or anything?
We have a lot. We have several different dialysis clinics that are full. There's a waiting list. My oldest son now has high blood pressure because he has kidney damage. All three of my sons have low vitamin D levels because their kidneys are not producing enough because they have been hit by this lead.
That's primary reason why I ran for office to begin with. I didn't grow up in the political world, guys. I didn't run for city council and then work my way up. I came straight from the emergency department because I take care of these patients that I care so much about, and it breaks my heart to know how sometimes politicians up here are so removed from the human face of failed policies, and they're not smiling. They're on hemodialysis. They're worried. And if we don't start prioritizing correctly our funding to help patients and help real people with real problems, and kind of make that our focus instead of, you know, prioritizing, putting at the top of our list, removing these protections in order to benefit, you know, some of the companies, then I think we're just going to have a worse human tragedy. And with that, I'm sorry you're going through this.
Thank you.
I'll be praying for you and your family. Thank you so much.
Thank you.